So if you're a new grad RN and they ask you, tell us about a time you made a mistake, you don't want to say, I've never made a mistake. Like, let's be real. Let's be real. You're a human being. You've made a mistake. You also don't want to say, I clapped back at a doctor that wasn't being responsive to my concerns, even though I was right. That's a great starting point, but let's make some tweaks. Firstly, by saying clapping back at the doctor, you're putting spotlight on the conflict, which is something we don't want to do. We want to emphasize the solution, not the pettiness. You also don't want to go with pettiness. You don't want to say, even though I was right, I did this bad behavior. You don't want to say that. As a nurse, you're going to be talked over, you're going to be yelled at. Even though you might be in the right, hiring managers don't want somebody that's going to explode and yell back at other nurses, providers, or even worse, patients. So for your answer, I want to tweak it a little bit because I love the part about you advocating for your patients, which is super important to nursing, but we need to do it in a professional way. Reframe it like there was a situation where there was some miscommunication between myself and the provider, which led to a delay in patient care. I let my frustration show in the way that I responded, and I wish I could have done so in a more effective way. Since then, I focused on speaking up in a more professional manner, and that way I can keep the focus on patient safety. Same story, but a different way of saying it. That way you sound more professional and more coachable. I hope that helps. Drop some more interview responses in the comments. Let's work together and follow me for more new guy tips.